Disturbing new developments surrounding the Zika virus, and this one is being called a game changer. A person became infected with the virus through sexual transmission, and it happened here in the U.S. The CDC is now expected to issue new guidelines in response.
Dr. Nandi joins us now to talk about these latest developments. And game changer to say the least.
It
How
really
does
is.
this happen?
Well, you know, people are wondering now where the extent of transmission is. First was mosquitoes, now it's sexual transmission. So Zika virus, once thought to be spread only by mosquito bites, was sexually transmitted to a person in Texas, health officials are telling us. The anonymous patient became infected after having sexual contact with someone who was ill and had returned from a country where the Zika virus was present. Now, people ask, so what's the best way to prevent this virus from being infected? So, you know, we think the major cause is mosquito bites, so prevent mosquito bites. Now, sexual partners can also protect themselves by using condoms. You know, it's just common sense to prevent spreading, you know, the sexually transmitted version of it. Now, this is not the first time this has happened. You know, so we've had other cases of Zika virus. In Tahiti in 2013, there was a case, and in 2008, a Colorado researcher also reportedly caught the virus when he went overseas and may have spread it to his wife. So it's not unheard of, but the first time in the U.S., so people are concerned what's going to happen next.
We know how it affects women, potentially, especially pregnant women. How does it affect men?
So here's the thing: we don't know how long the virus actually is in the semen. We know that the virus can stay in the blood for about a week, right? So you can get the infection for about a week in the blood, and the symptoms can be there from anywhere from a week to 10 days. But we don't know how long it stays in the semen. That's an important question, because you've got somebody who gets infected, then has sexual relations with his wife, who then becomes pregnant, and that's the key. As most of you remember, the major problem is with pregnant women, because what can happen is that then do they get possible birth defects. The relationship is not completely clear, but we think that there may be something called microcephaly that can present with people who get infected with the Zika virus.
So is there a period of time that you have it and don't know you have it?
Yeah, it's a really important question. A lot of people get it, don't even know they have it, because the symptoms can be very mild. And so that's why we say that people who go, for example, overseas, if you're pregnant or thinking about being pregnant, becoming pregnant, you shouldn't go because you may not have any symptoms. So what about some prescriptions that I can give you? Number one is that avoid being bitten by mosquitoes. Pretty common sense stuff. Wear long sleeve shirts and pants, even in places where it's a little warm, because you want to make sure that you prevent the risk. Also, use EPA-registered insect repellents because you want these mosquitoes not to bite you. Also, listen to travel warnings from the CDC. Also, you know, tune into 7 Action News. We're on top of it. That there's a new warning or there's something that's going on, we'll let you know. So it's important.
So before we let you go, Doc, one of our viewers has a question about the Zika virus. Okay, so we know how it affects pregnant women, but what about women who are not pregnant and they're bitten? Maybe they later become pregnant.
Yeah. So what I would say is that if you're thinking about becoming pregnant, then definitely don't travel these areas that they say that you shouldn't, even if you're not pregnant. The problem is that, like you pointed out, Glenda, is that we don't know if you've got a mild infection. If you have a mild infection, you don't know you're infected, and then if you have a baby with this problem, it could really be a big problem.
Testing is also a concern at this point as to developing an accurate and a better test.
Exactly, and then I think also the men. What about men? We have to worry about men and how they can spread it, especially with the sexual transmission. The last thing I'll tell you is a development that came out is that with increasing heat, that the virus can actually be transmitted quicker. So in these areas where it's hot, the mosquito can actually be more effective in spreading the virus and do it earlier. So that's the idea. When we go to these hotter areas, that's where you can get the infection.
Seems like a climate change relationship on that.
Absolutely. Places in Mississippi and places that get warm down here also can get the problem.
When you talk about climate change, we're going to send it right over to you, Dave.